All right, let's bring the discussion back home now. The coronavirus crisis in South Africa is proving to be the largest target of corrupt government officials. Tender irregularities, overpriced mielie-meal, disappearing food parcels, a door-to-door COVID-19 campaign that cost the Eastern Cape over 4 million rand, an improper water and sanitation contract in the Northwest, and the overpricing of personal protective equipment. These are just some of the projects used to plunder public funds. Let's take a listen.
The challenges of this coronavirus does not require a stressed leadership, for that weakens the immune system. That is why if you are contemplating to discipline anyone who must be held accountable for wrongdoing, if that person is in quarantine because he's ill, don't act against that person.
Right, interesting sentiments there. Let's unpack the story. Corruption Watch is calling for all information relating to the procurement of goods and services for COVID-19 to be made public. And for more on the story, we're joined now by the head of legal and investigation at Corruption Watch, Karam Singh. Karam, thanks very much for your time this morning on the AM report. This was one of our biggest fears, wasn't it? As we went into the lockdown, we knew there were certain things we needed to procure. We needed to procure it quickly. And, you know, you yourself, I'm sure as Corruption Watch, you were looking at the millions, the billions of rand that would be needed for us to prepare for COVID-19, and alarm bells surely must have been going off in your mind then already.
No, absolutely. Thank you. And thanks for your time. Look, I mean, prior to the COVID crisis, I think we were already sitting with a serious corruption challenge in the country. And part of that corruption challenge relates to the challenge we have around being able to monitor what government actually does and how they spend their money. So we have agencies in the state like the Auditor General that are empowered to uncover these kinds of spending activities. But what happens now is that we have a mass mobilization of resources, and it's not clear that we had the capacity within the state to monitor how that money is spent. And it's not clear that we actually have the proper detection mechanisms mobilized in order to make that fight. And part of what we're saying as Corruption Watch is that we need to mobilize the capacity that we do have within the state so that we can have more of a proactive approach to understanding how money is being spent, and where possible being able to detect from inception, or at least early on as possible, where some of that irregular spending is taking place.
No, absolutely. Having said that, though, you know, plundering the state as it tries to prep in the midst of a pandemic, that must be a new low, even though our own relationship with corruption as South Africa goes back so long.
You know, unfortunately, you know, those engaged in corrupt activity, those involved in irregular spending, you know, have a different kind of moral, ethical compass than what one would expect from public officials. So when you had this mobilization of resources, it's almost expected, unfortunately, given the state of irregular spending, maladministration, and fraud, that you would have opportunists at various levels in the supply chain taking advantage. So, you know, it's also important to note that this is not a problem just of state officials, but we do have private sector actors who are engaged in these kind of activities. We've seen Discam go before the Competition Commission and Competition Tribunal finding around price gouging for PPE equipment, and they've been hit with a fine. So, yeah, I mean, there are lots of different actors in this process. I think what we're calling for is a mobilization of the capacity that we do have in the state to engage in some of the investigations that are required to detect this stuff.
And I mean, I've got a list here. It's this whole page, this whole A4 page, and it continues on the second page here. A list of how funds have been spent improperly. I'm just going to read some of them out to you. The Eastern Cape Education Department apparently spending 5 times the normal price, and that's for substandard personal protective equipment. In KZN, the Social Development Department reportedly spending 22 million rand on 48,000 blankets, and that comes to a cost of 460 rand per blanket. And the list goes on and on. The OR District Municipality, the OR Tambo District Municipality, receiving invoices to the tune of 4.8 million rand. That's for door-to-door COVID-19 training. I mean, how do we backtrack? Surely, this is a discussion we had with the AG as well. Surely the process is just as simple as going back to the procurement process. Who signed off on this invoice? Who allowed for this money to be paid out? Is it not that simple?
Yes. Well, yes and no. I mean, procurement is complicated. And one of the things that is required in the regulations is that government does publish this information. But what we find as civil society is that we find it very difficult to access that information, that the information isn't necessarily published in a timely way, that it isn't published in a data form that's easy to access and easy to read. So we're really calling for a sort of systemic approach to ensuring that all of this information is made public so that the Auditor General can do their job, so that civil society can begin to monitor. But I think, the other key thing that's been out there is the activation of the Special Investigations Unit to get a proclamation to investigate these issues. And I think that would be an incredible benefit to the anti-corruption fight if we could see an SIU proclamation in this area. So, as you say, it should be so easy and it should be so easy to trace. But in fact, those who are engaged in corrupt activities also engage in activities to avoid their detection. So the information that you have is often only a surface because of courageous people within the departments who blow the whistle and who bring the information to the media and bring the information to Corruption Watch.
Yeah. I mean, you talk about, information not being readily available, information on how the money is spent by government. Is there, in your mind, an attitude problem with some officials in government? I'm thinking about the COCTA MEC, Mielie-Meal, and he was talking about, he says he was quoted out of context, but he was talking about, not stressing out those who are in COVID-19 isolation when it comes to pursuing issues of corruption. So the question is, do we need an attitude change in how we pursue those responsible for corruption as government?
Absolutely. This is not an either-or situation. It's not like we're living in a public health pandemic and then we put the rule of law to side. Obviously, the crisis that the health system is facing and that officials are facing and that frontline personnel are facing in that is something which we have to be incredibly sensitive to. But that can never be an excuse to hide behind corruption, hide behind unauthorized expenditure. It's not the nurses, it's not the frontline medical officials that we're pointing the finger at. It's really officials in the system. And I think, I hope he was quoted out of context because to use something like that as an excuse is really not acceptable, I think, in the current situation.
Yeah, absolutely. Well, thanks very much for weighing in on this incredibly important discussion, corruption during the time of COVID-19. That's Head of Legal and Investigation at Corruption Watch, Karam Singh. That must certainly be a new low, stealing from government coffers during a pandemic.